Erectile dysfunction, alternatives to Viagra. Viagra was the first oral pill to treat erectile dysfunction and was approved by the U.S. Food and Drug Administration (FDA) in 1998. So, when you think of erectile dysfunction, you would naturally think of Viagra. But the problem is Viagra is not right for everybody. Alternative medications for erectile dysfunction. There are quite a few alternatives to Viagra on the market these days. Most work by improving blood flow to the penis, helping to maintain an erection long enough. Most medications are designed to work alongside physical or emotional sexual stimulation to prompt an erection. But people can react differently to each medication's unique chemical makeup. So, it may take some trial and error to determine which one works best for you. Other prescription medications used to treat erectile dysfunction include the following. Cialis. Cialis works by helping to relax the blood vessels in the penis, allowing blood to flow into the penis, causing an erection. You should take it 20 to 30 minutes before planned sexual activity. An erection is possible for up to 36 hours after taking it. You may have the ability to have an erection for this longer period, but the actual erections will only last a normal period of time. The starting dose is usually 10 mg, but it can be increased or decreased as necessary. You take it as needed, but never more than once a day. Cialis can be taken with or without food. It won't cause erections on its own, sexual stimulation is still needed. Cialis does not cure erectile dysfunction, there's also a once-a-day version. These 2.5 mg tablets must be taken at the same time every day. Levitra. Levitra is indicated for the treatment of the inability to achieve or maintain penile erection sufficient for satisfactory sexual performance in adult males. Levitra is not indicated for use by women. You should take Levitra about 1 hour before sexual activity. The starting dose is usually 10 mg. You shouldn't take it more than one in a day. These oral tablets can be taken with or without food. Ivanafall. Ivanafall is used to treat male sexual function problems. In combination with sexual stimulation, Ivanafall works by increasing blood flow to the penis to help a man get and keep an erection. This medication comes in 50, 100, and 200 mg tablets. It is to be taken 15 to 30 minutes before sexual activity, but never more than once a day. It can be taken with or without food. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Testosterone. Doctors sometimes prescribe testosterone to treat ED. In fact, PDE5 inhibitors are most effective when used alongside testosterone therapy in men with a testosterone deficiency. The drug does come with risks, however. Testosterone can increase your chance of a heart attack or stroke. Because of these risks, the Food and Drug Administration (FDA) says that only men who have low testosterone due to certain health issues should use testosterone. Risk factors and side effects. Some erectile dysfunction medications can interact with other medications and cause serious side effects. Before taking any erectile dysfunction medication, tell your doctor about any pre-existing health conditions you have. You should also discuss any other drugs or supplements you're currently taking. Headache, flushing, or dizziness may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Most people using these medications do not have serious side effects. Sexual activity may put extra strain on your heart, especially if you have heart problems. If you have heart problems and experience severe dizziness, fainting, chest, jaw, left arm pain, nausea, muscle pain, stuffy or runny nose, changes in vision while having sex, stop and get medical help immediately. Although it's uncommon, some erectile dysfunction drugs can cause a painful erection that won't go away. This is known as priapism. If your erection lasts more than 4 hours, you should seek immediate medical attention, otherwise permanent damage may occur. Natural remedies for erectile dysfunction. Due to other health conditions, you may not be able to take an oral medication for ED. Many men prefer a natural option when available. Many herbs show potential to be effective in improving men's sexual function, but little evidence actually exists to support the use of any herbal medication in the treatment of ED. People should always exercise caution when taking any form of herbal supplementation. Whatever alternatives you choose, it's best to discuss it with your doctor before use. L-arginine. L-arginine is an amino acid naturally present in your body. It helps make nitric oxide. Nitric oxide relaxes blood vessels to facilitate a successful erection and is essential for healthy sexual functioning. There is some evidence that high doses of L-arginine can improve blood flow and help ED. L-arginine in combination with other medications is well tolerated, safe, and effective for mild to moderate ED. Potential side effects of use include nausea, cramps, and diarrhea. Red ginseng. Called the herbal Viagra, red ginseng has solid research behind it. This herb is known to have anti-inflammatory action, improve lung function, and improve blood flow in other diseases, all characteristics that may help reduce ED. Tell your doctor if you're taking other medications because they can interact with the supplement and lead to harmful side effects. Ginseng may lower blood sugar levels, so it should be used with caution if you take medication for diabetes. Rhodiola rosea, Arctic root or golden root. Rhodiola is an herb that grows in the cold, mountainous regions of Europe and Asia. Its roots are considered adaptogens, meaning they help your body adapt to stress when consumed. Its root contains more than 140 active ingredients, the two most potent of which are rosavan and salidroside. People in Russia and Scandinavian countries have used rhodiola to treat anxiety, fatigue and depression for centuries. This herb has been shown to improve energy and reduce fatigue. A small study indicated that Rhodiola rosea may be helpful in treating erectile dysfunction, but more studies are needed. DHEA. This dietary supplement is made from wild yam and soy. Dehydroepiandrosterone (DHEA) is a natural hormone produced by your adrenal glands. It can be converted to both estrogen and testosterone in the body. Men with ED were more likely to have low levels of DHEA. A study in 2009 found that men receiving the DHEA were more likely to achieve and maintain an erection. It has also been identified as an option for treatment of ED for men with concurrent diabetes. Horny goat weed Epimedium. This Chinese herb has been used to reduce the causes associated with sexual dysfunction, including erectile dysfunction. Some women also take it to reduce the incidence of painful intercourse and loss of libido. The only study conducted on this herb was published in the Journal of Sexual Medicine. They studied the effect of a purified extract of epimedium on rats. They found that rats who received the extract demonstrated greater incidences of blood flow than those who didn't. This herb could affect a person's heart function. Those with heart disease should not take it as it can cause irregular heartbeat. Horny goatweed can also interact with other drugs. Ginkgo biloba. Ginkgo biloba is an herb that has been used for thousands of years to treat a number of health conditions, like dementia, anxiety, and poor blood. It is thought that taking ginkgo for erectile dysfunction dilates blood vessels to promote blood flow to the sexual organs. However, there is unclear scientific evidence for the herb's use. Ginkgo can increase the risk for bleeding, and people who take blood thinners should not take it. Other side effect risks include nausea, headache, stomach upset, risk of bleeding and mouth irritation. Acupuncture. Acupuncture is an ancient healing practice used for a variety of conditions. Though studies are mixed, many show positive results when acupuncture is used to treat ED, but more studies are needed. The risks of acupuncture are low if provided by a licensed acupuncturist. If you're considering acupuncture, search for a qualified and certified practitioner. Hanbei. This supplement is extracted from the bark of the African Hanbei tree. Some studies have shown positive effects on sexual performance with use of this drug. However, the American Urological Association doesn't recommend Hanbei as an ED treatment, because there's not a lot of evidence proving it works. Hanbei's side effects might be damaging to health, including increased blood pressure and heart rate, irritability, and tremor. If you decide you want to try Hanbei, be sure to talk to your doctor beforehand. Vitamins and supplements. There are many vitamins and supplements on the market that claim to help ED. Some promise better sexual function as well as increased energy and vitality. However, there is not much research to support this claim. Some supplements that are marketed as natural may even contain drugs. Take these with caution, as ED supplements can still interact with other medications you're taking. They may also cause side effects. Talk to your doctor before using any vitamins or supplements for ED. Other things to try include: ED may be a symptom of an underlying medical condition, so consult your doctor. You should also mention any other symptoms you may be experiencing. They can help you determine whether your ED is isolated or related to something else. Treating the underlying condition may resolve the problem. Other tips to keep in mind while treating ED: always take ED medications exactly as directed. Talk to your doctor before increasing the dose, and report any troubling side effects. Don't mix treatments. Taking an oral medication while using a natural remedy may cause harmful side effects. Natural doesn't always mean safe. Herbal or other dietary supplements can interact with medications. When considering something new, consult with your doctor or pharmacist, and be sure to report side effects. Aside from drugs and herbal remedies, certain lifestyle factors can contribute to ED. Whatever treatment you choose, it may help if you also avoid or limit alcohol use. Quit smoking. Maintain a healthy weight. Get sufficient sleep every night. Engage in regular exercise, including aerobic exercise. Try pelvic floor exercises. Other methods to treat ED include blood vessel surgery, vacuum pumps, and penile implants. If the problem persists, talk to your doctor about these and other alternatives. If you enjoyed this video, please click the like button. We need your support to keep posting, so please subscribe and click that bell notification button so that you get notified when I post new videos. And if you would like, leave a comment below. Thanks for watching, and I will see you in the next video.